I'm not going to really show you. I will kind of show you how each one of the mechanisms work. I'm going to tell you that probably these three are going to be the ones that you'll like the best. I'm going to let you practice with them, and then for the practical, you can figure out which one you like the best. Now, for you, do you know which one they're using at Memorial?
This one.
This one. So you might want to practice with the one that you would be using more. You know you would be using more. And you may have you gotten to play with it at all?
A little bit.
A little bit, good, okay. So this will actually help you for clinic as well. These are in PSI, so pounds per square inch, little dials, all right? This one actually has PSI and ATMs. I'm not gonna go, this one has PSI and ATMs, this one does too. They all actually have PSI and ATMs. Atmospheres and pounds per square inch. So actually we're using atmospheres, I'm sorry. The pounds per square inch is the bigger number that's on the inside. The atmospheres of pressure is the smaller number that's on the outer side. That's what we actually use for our inflation is atmospheres. What we need for this, do you have that bottle of contrast? Did you fill it? Or has it still got some in it?
I can buy these.
Okay. So, I'm going to just take these off for a second. People do these a couple different ways. I like to use my little cup for my inflation solution. So I talked a little bit about this in class. You're going to need some saline, and the concentration can be 50-50 or 60-40, somewhere around that. If it's 60-40, you want to have more flush than contrast, okay? I'm going to put in the amount of flush that I want, and then this is one way that we can get the contrast. So Kaylee's going to come and just pour it off. Okay, that's good. That's enough. And I'm going to label its contrast and its heparinized saline now. And so this is my little mixture for my inflation device. Remember we talked about when we inflate the balloons, we don't want to have air in it. You can't see air on x-ray, so we couldn't see these balloons expanding, these stents expanding. And we don't want to have air in case that balloon did pop, okay? So if it popped, then we would have an air embolus in the coronary artery that we don't want, okay? And depending on how much air we had in the balloon, if it's just a little micro bubble, then it might not be the end of the world. Not going to kill the patient, but we have to use this fluid mixture. The reason we want to have not too much contrast is it's very thick, right? When we go to try to deflate the balloons and inflate the balloons, having that thick fluid is going to slow down that process. And we want it to be a little bit faster. That makes sense. Hopefully it does. Other than me just saying, this is how it is, and that's how it is, you know. So we get our mixture. Some people actually will get a mixture in a syringe, a little bit different, so they may have the contrast poured off. I've seen some people actually will take it from this bottle and fill their syringe from the bottle that they hung there. One of the things we do have to remember, we haven't talked about this yet, you may have heard them say this at the end of the procedure, how much contrast was used, right? You've heard that. All of you have heard that, hopefully. If you're paying any kind of attention, you should have heard that. They tell them 100 cc's or whatever. What they're saying is how much contrast was put in the body and is being metabolized by the body. This doesn't count because this is in the balloon and it comes back out of the body. The thing is though, if you pull contrast out of that bottle to fill your cup, instead of having them pour it, you have to subtract that because that amount did not actually go into the body. So just something that you would have to get used to. Have you noticed how did they get their contrast at Memorial?
They have like a smaller bottle of contrast that they pull out, and then they
Pour it like
pour it
she
into
just
there,
did?
yeah.
So good. That's how we do it at Riverside also. Okay. All right, so now we need to prep our inflation device. That means we need to get it ready to be able to put onto our balloon. I'm just going to demonstrate a little bit about that. So you have to unlock. Each one of these has a different locking and unlocking mechanism to be able to make this plunger go in and out. Okay, this one is this little yellow button. You have to push and hold it. See the plunger go out, plunger go in. I let go, even I'm out, I can't push in. Now, what I can do is dial. I can twist it and it'll go without pushing, but that's very slow. Now, when we're doing our inflation, we will be doing this kind of motion, and I'm going to demonstrate that in a few minutes. This one is these little white pieces. You push down and hold, and that is how you manipulate this plunger. You also can do the twisty motion. This one is, the black piece is a lock and an unlock, okay? When you have this arrow, that means it's unlocked. You can push and pull the plunger. You turn that, you can't push and pull the plunger. Now, you can dial, I think this one, yeah. But nothing's happening because we don't have a balloon attached or anything, okay? This one is just a little flip over. That's locked, and that does like a little padlock looking lock to tell you that. Flip it over this way, it's unlocked. I'll let you play with all of these to see which ones you like. This one is this little lever here. When it's up, it's locked. When it's down, it's unlocked. Okay? Now, I'm going to demonstrate on this one because this is the one we use at Riverside and Southside, and one I've used forever. So this is the one I'm going to demonstrate on. So to prep your inflation device or get it ready to be able to do your procedure, so I'm going to say it's prepping it, you're going to have to pull in this fluid, okay? So obviously it's going to come out of the package with nothing, air. You're going to pull back and completely fill the syringe. Now you're going to have some air, so what you want to do is just kind of tap it. We're not going to probably be able to get every single bubble. We're going to get as many as we can, and then we're going to expel the air back out. Now this is where you'll have to get used to the device. If you push too much, see, you're going to push a lot out, okay? Now that's going to be a problem when we're trying to actually prep the balloon. We have to be more controlled. So I'm going to show you a little more control. What I like to do is just gently push, and I see I'm kind of rocking it as I'm pushing. Stop when I get the fluid about right there, and then just twist out my air bubbles. And if I get it back in, that's great, but if I don't, it's not gonna be the end of the world either. Just make sure you don't put it back in your flush bowl because it does have contrast in it. This needs to stay clean flush and only flush. Now, you don't want to fill this completely full, and I'm gonna show you why in a minute. Be still, get on my nerves. So I am just gonna go ahead and push out and only leave about 15. So most of these only hold about 20 cc's. You don't want it completely full because when we go to prep our balloons, you have to be able to pull backwards. You have to be able to pull air out of the balloon and into here to be able to prep it. So if you filled it completely full, you don't have any room to draw back. So kind of think of the doctor's flush syringes. You don't fill those completely full, so you can kind of aspirate, right? So this is prepped and ready to go. The same with this one. I'll demonstrate with this one. Just push in the yellow, draw back. You can use the table. Different little techniques you can do. Meryl, you okay? Do you need to sit?
I'm busy. I'm a little
Sit down in the chair
Okay.
and pull it over here. Okay, and so those two are prepped and ready. I'm not gonna go because you guys can play with them and prep them if you want to. But I demonstrated those, okay? Now, we're also gonna have to have what we call a high pressure stopcock. So there are some stopcocks that aren't high pressure and there are some that are high pressure. They're high pressure because they can take those atmospheres that we're gonna be putting when we're inflating the balloon, okay? I like to go ahead and put mine on. Now, what I'm gonna show you is two different ways to prep the balloons, and I'm gonna show you how to prep the over-the-wire balloon and the monorail balloon, okay? So we're gonna just put these out of the way. Actually,